Hey everyone, this is Scott with special guest Heidi Jannenga, founder and president of WebPT, here as a special guest appearance on our Tuesday tips. So all this month we've been talking about population health, and so I thought it would be an awesome opportunity, since I happen to be in Phoenix, to chat with Heidi a little bit about her views on population health, specifically as it concerns outcomes tracking tools. So one thing we know is that there's a big focus right now on population health all throughout healthcare, and what we're trying to get start talking about more is that PTs are going to have a huge role in managing population health. And one thing I think we can say for sure is that patient-reported outcomes measurements are going to be really important to the future of that. So Heidi, I'd love to learn a little bit more about sort of your outlook on outcomes tools and how you could see that really shaping the population health landscape in PT.
Yeah, well, first and foremost, Scott, I just want to welcome you to WebPT HQ.
It's a wonderful place. It's a wonderful place.
Hopefully no Nerf guns will be flying in as we're doing this interview here.
We haven't been shot yet.
Yeah, we haven't been shot yet, but you never know.
Yeah, it's true.
So, obviously outcomes have become sort of a buzzword, more recently, and, with the triple aim kind of coming into play, one of the pieces of the triangle has been outlined as outcomes. In our quest towards improved quality of care, we're now starting to understand sort of the value equation, if you will, that has to include outcomes along with, understanding how to decrease the cost of care, but then, as you guys obviously are emphasizing, also the patient satisfaction component to that, right?
Yep.
And so outcomes for us has been one of our, major components on our roadmap. When we think about specifically outcomes for physical therapy, there's kind of two things that we think are really important. First and foremost, you have to be able to collect it. And so having use of outcomes that are readily now already used within the industry is extremely important. But not only that, but outcomes that have scores that transcend just our own discipline, but can be understood cross-disciplinary, across multiple disciplines, if you will, I think is really, really important. And so, as an example, the oswestry can be understood by, surgeons and primary cares as well as physical therapists. So that's first. Second is just the data collection, not only the data collection, but the analysis. I think that's what's been missing for such a long period of time. And so truly understanding on a broad scale and embracing, first and foremost, that data can be a good thing for us as an industry, and understanding what all of that means. So for us, the aggregation of outcomes paired with the clinical data and then paired with the cost of healthcare, right? Or cost of a therapy visit, cost of a therapy episode of care. Marrying all of those pieces together really is going to have a huge impact on the value that we're able to deliver or show finally as an industry to those who are really caring about this.
Yeah, I totally agree. Don't be afraid of the data, PTs. I think that's one thing we can learn from this. Maybe that's the whole tip. Don't fear the data. It can do a lot for you.
Well, I mean, it's also, it's about understanding that when you deliver physical therapy earlier in the episode of care, right, and it has a huge cost savings effect downstream. So instead of going to the surgery or medications or any of those things, right, even the chiro. I mean, chiro is appropriate at certain points in time, but physical therapists need to have a seat at the table, and right now we are still sitting at the kids' table, in my opinion.
That is for sure, and I know it's a thing we like to talk about all the time, but you're looking at 165 million adults developing musculoskeletal injuries every year, yet about 9% actually go to PT. It's terrifying, and so we know we're low cost, we know we provide an awesome outcome, but yet having that seat at the table so that we can, ultimately we can provide the service that's ultimately going to be the most beneficial to the patients. I think outcomes tools can help us get that seat at the table, provide that data to ensure that we're able to justify what we do.
Absolutely. And who better to be, treating the neuromusculoskeletal injuries and diagnoses that are out there. But not only that, we're talking about diabetes and obesity, which are, two of the largest, most expensive diagnoses that are out there right now. And, physical therapists should be at the forefront of seeing those patients early as an early intervention.
Definitely. So huge opportunity, PTs. Definitely start tracking that data so that you can understand how you're actually helping those patients in a more qualitative way, quantitative way, and so we can start getting a seat at the table, improving our place in the overall healthcare system. Heidi, thank you so much. This has been great.
Yeah, absolutely.
This has been wonderful.
Love having you here.
Awesome. All right, guys. As always, thank you for watching.
Right.
Feel free to reach out to us. We'll include some extra info. You can hit us at strive_labs at Twitter or hello@strivelabs.com. Or Heidi, what's the best way to get in touch with you?
At Jannenga, or at Heidi Jannenga on Twitter. We're on Twitter at WebPT. Those are probably the best ways to get in touch with us and have a conversation.
Cool. We love chatting. Thanks as always. Bye.
Take care.